on a couple things. For me personally, the important things and the things that people want to look at, because everybody goes into your practice or people ask me consistently, how can I lose weight? How can I maintain weight loss? How do I make myself feel better? Personally, the important things and the things that people want to look at, because everybody goes into your practice or people ask me consistently,
take this,
how
take
can I
that,
lose
let's go,
weight? How can I maintain
this.
weight loss?
Those
How do I
are
make
difficult
myself
tasks,
feel
better
better?
that are needed.
Important things and the things that people want to look at, because everybody goes into your practice or people ask me.
And I'll show you why this is on the right path. Essentially, you look at body weight that's been lost once you actually take this. Your body mass index actually is reduced, trunk fat is reduced, lean body mass is actually increased, which is actually pretty nice. And when we look at aging, IGF-1, one of the most important things that we described earlier, it's reduced significantly for those that have taken this diet. And systolic blood pressure is actually reduced significantly for those that are taking this diet. And we discussed this in the concept of doing, of course, not dangerous drops in biomarkers, not going 5-day fast, 3-day fast, where sometimes you really got to watch it because you have to maintain and understand your overall general health and what you're doing before you actually go into this. We understand that we can actually drop IGF-1, we can reduce your fasting glucose, we can reduce your systolic blood pressure. And these type of things, a lot of people ask, okay, so what transpires if I get off of the diet? Well, essentially what transpires is actually, believe it or not, you maintain this. This is actually after 3 months of doing the diet, where 60% of the individuals maintain the reduction in waist circumference, 55 in systolic blood pressure, 64% maintain the body weight loss, and 71% maintain their body mass index from before it. The other thing is that a lot of people following this, when we ran surveys of it, they felt a lot healthier. They felt a lot more motivated to actually adopt a simpler lifestyle. Just understanding what's in the boxes, what you're consuming for 5 days, and the struggles or what you wanted to do for those 5 days of sticking to that diet just make you a lot more health conscious. 80% of them were more mindful following the diet of what they wanted to eat. They wanted to make sure they maintained that weight loss. They had more control over their health. They decided to establish healthier eating habits. They had less food cravings once the fast was complete. They improved mental clarity and focus. This is really, really important because that feeling, which a lot of people describe, a lot of people talk to me, one of the first things is foggy, I don't feel well. What are one of the first steps I can take? Take control of your diet because it's actually something relatively easy that you can do. You have complete control over it, not somebody else telling you to take a supplement or you taking supplements. You have more control over it. And greater energy levels, which are actually needed to make sure that you can go out there, you can go walk, you can go exercise, you can go complete what you need to do. I truly believe that this is something that everyone should try to incorporate into, number one, is their lifestyle. And number one, actually introducing this to your patients, because it actually gives you an opportunity to take a simple step and try this out. For instance, try this out on yourself, try it on your staff, then introduce it to patients, because not only that is you can tell your patients, try this diet, it's 5 days, it's like you've been actually fasting for much longer than that. And then let's do some blood work beforehand, because I'm going to take blood work anyway. And then let's take some blood work after, and I can monitor you when you come back. So now you have your patients that are eager to do this, eager to lose weight, eager to feel better, and they're going to be even eager to come back and understand what has transpired when they've actually done this diet. Let's see what has happened with my blood work. Let's see what changes have transpired from taking this diet, from doing this diet. This gives you a complete personalized approach, just so you know too, because everybody thinks, well, the diet is a diet is a diet. No, it's not, because inside of there is a specific drink that it's based on body weight that you actually take a certain amount, only based on body weight. Not only that, L-Nutra and Prolong, actually, we give you actually physical, so we give you support. We give you support that you have healthcare coaches that are available. We have all the resources that you need, and even your patients need, that they don't even need to bother you. They can actually contact us direct with questions with anything that they need. So we're here to support
review. Here's some of the literature that I've actually cited on there. If you have any questions, if you're interested in bringing this on board in your clinic or anything, please contact Antonio Perez at the email here. And if there's any medical inquiries, any medical questions, concerns, anything about it with patient-specific allergies, anything, we're here to help. Our complete medical team and our science team is here to help. My personal email is rgonzalez, just like my name, Rafael Gonzalez, at elnutra.com. Thank you very much for your attention, and I am open to any questions, concerns, or any of it. Thank you.
Hey, Rafael, thank you for that excellent presentation as always. I guess the one question we have, should we check blood tests before doing the prolong?
I 100% think you should, and I think it would actually be really important to do this. Many people focus on, and this no matter what tells you where you're at when you start, and then doing it after. A lot of people focus on, believe it or not, doing blood work when they're sick, and then once they feel fine, they don't do the blood work. And I think probably the most important thing is to do the blood work when you feel fine, because then you know what actually transpired and what worked and where you should be. So I think it's important to actually do both, before and after.
Sounds good. That's all the questions. Thank you a million as always.
Thank you very much. Take care and have a great day. Thank you.
We'll see you soon.
Thanks.
Okay, Dr. Loinhart, Tracy. We are gonna start next.
Turn my video on.
Good morning.
Hey, Sahar. Can you, the host, turn my video on?
I think we give you the power. I think you have to do it.
There it goes.
There we go.